But welcome to the Waismann Method Podcast. I'm your co-host, Dwight Hurst. I'm going to be joined today by Clare Waismann, as always, and we are lucky once again to have David Livingston with us. Claire and David are going to try to help me sort out answers about how the COVID-19 pandemic is affecting opioid dependence, alcoholism, or other addiction issues. I'll be honest with you, for me personally, it was a very healing conversation with all the anxieties that are out there around what's going on. I felt like talking to Claire and David actually helped me personally to feel a lot better about what was going on. So I think you're going to also find it to be healing and helpful. So why waste time? We'll bounce right into the call as David answered the phone and was ready to crisis counsel myself and Claire. David, Claire and I decided that you're just going to do therapy on both of us for this call with all of our issues with the virus.
I think we're in trouble.
We're talking, David. You know, it's we feel so weird of doing anything, being anywhere, breathing anything. It's just like Dwight asked me, "How are you doing?" And I was telling him I asked Jade this morning, because I speak to her, a million times a day, not to ask how you doing, Mom, anymore. And I won't ask her because we really don't know what to respond.
Yeah, it's all relative. Is it compared to the before times, so to speak, before the last couple of weeks? Or, yeah, because it's, I've been talking to a lot of people with anxiety being activated. And it's like, yeah, we all have kind of a low-key panic attack all the time right now. It really is. There's a lot of things out there to be legitimately anxious about, and then just the way that some of our minds play with that too. I know for me, I get really worried.
It's true. It's true. I heard someone say on TV, and I stole it from them, that you're as healthy as you feel, not as healthy as you fear. And I try to remind people of that, because I actually feel very healthy. I feel good. But right, it's a strange time, and you look around and there's, cause for anxiety and fear. So it's a hard thing to sort of separate.
Yeah, I like that. I like that phrase too, of you're healthy as you feel, not as you fear. I like that. That's quite good. I'm going to steal that from you. You said you got it from somewhere else, so I hope that's okay.
I think anything that is helpful right now, right?
Exactly.
That's one of the things I know we wanted to talk about today, as we're talking about it, is about the effect that this is having upon people who are struggling with dependence or addiction issues. And it was funny, right when we were planning on having this conversation, I think it was later that day, I have a friend of mine who works in the mental health field back east, who he tweeted something about it, where somebody had tweeted out, "Why are the liquor stores open?" And he tweeted back and said, "Do you want people going into DTs, or do you want people having, health problems all of a sudden who might have a drinking problem, and then we're going to have more people at the hospital?" And I thought, someone working in our field thinks that way, right? We think about, well, wow, what about this part of the population? How are they getting affected? I mean, because you got people on all sides of the spectrum, right, who have started treatment and then their treatment's now interrupted, or people who are not in treatment and perhaps their functioning is interrupted with how they get by with their habit.
Dwight, I was actually responding to exactly the same comment on Twitter, because I think it's not the right time to have decisions made based on panic. I think it's not the right time to make extreme decisions that might harm so many. Alcohol withdrawal is an extremely dangerous event that has to be, medically assisted. And we can't just suddenly throw all these people out there into a full withdrawal when hospitals don't even have the capabilities of taking the people with the issues they have right now.
Right,
it's not just the coronavirus, you know?
Yeah, we start another health crisis in the midst of our health crisis.
Correct. So obviously, there is things we can do to limit, what people buy, how much they buy. But we can't just make extreme decisions that is going to put so many at risk at this point. We, as medically assisted opioid treatment, have been asked by our hospital to limit for the next 2 weeks admissions, because our hospital is a hospital where they are trying to keep atmosphere that is virus free. They do own another 3 hospitals where they have patients with the corona. So they're trying to keep this hospital that we work from without any, infected patients. They're saying, please, emergency cases only. Let's not bring anybody that is not an emergency health situation, because obviously, especially younger people that can be, asymptomatic, can actually infect everybody in the hospital because we wouldn't know that they have it.
Well, and that's a big thing just from a general sharing the disease standpoint, that people don't think about that, of being asymptomatic. Yeah, it kind of, so you're going through the same thing as a lot of clinics and hospitals, which is everything that you can push down the road safely is, right? I mean, basically.
Correct. So we did admit, 2 patients today were using heroin. So they are at risk. But for the next 2 weeks, we are going to push back. And if patients are taking other things, that are prescribed, we're asking them, to hold on for a few more weeks, because they are safe. We just have to work everybody together, to get through this without any additional risk for, the patients, our staff, and everybody else. It's a very difficult place to be,
It's a difficult balance, because I think in terms of substance use, there's the chemical aspect, that medical aspect, then there's the emotional well-being aspect too, of saying, when is someone at that risk? And I guess that's a hard criteria to strike.
Correct.
I mean, I wonder if that might be a good thing for us to share a little with people, is the idea of how do you know if you're in a crisis, as far as, I'm in a situation in which I really need to be getting in right away, because some people
Correct.
are going to try to avoid going to get help.
Regardless at this point, if that's the case, I'll let them speak to Dr. Lowenstein that could medically evaluate them and talk to them about options. Worst case scenario, if it's an emergency crisis, then the hospital would take them. But that's where we are right now.
What are some of the risks that you think about people out in the community, people who don't have access to treatment right now, might be going through?
Again, there's so much risk out there. I think if they are out there buying drugs in the street, obviously they are at risk. They're more at risk than the normal risky life they have.
Yeah, I mean, that's one of the things I've been thinking about, is the drive. And we talked a lot the last recording. We talked about the opiate withdrawal starting to be triggered, and how people are not only chasing a high, at some point they're just trying to not go into withdrawal. And so that's a pretty strong drive to get out there on the street and try to find, which obviously there's just from a very basic level, the risk of increased risk of exposure if I'm out, particularly if I'm out in some of the areas, and consorting with people that I have to find, and maybe do I even go to my regular dealer? Not that that's necessarily safe, but it's definitely safer than trying to find someone new in the midst of a crisis.
I have spoken to some patients that at this point, with everything that is going on, makes you think maybe it's time. Maybe it's time to do something about it. I don't want to be a slave of this anymore.
Mm-hmm.
Well, I think that's it. I think that, from a psychological perspective, what's happened is a society is we've all panicked to some degree. So, and if you think of panic as a moment of pausing, right, and evaluating, right, which is really the healthy function of a panic. It's to stop and to assess danger. So that's what everybody's doing. That's why everyone's kind of reading their, all the information that's coming out and watching television, because there's an ongoing sort of sense of an anxiety, and the healthy function of anxiety and panic is that it makes everybody pay attention. That's also when actually people often get into treatment, and when people talk about hitting rock bottom, really what they're talking about is a moment of psychological panic. So the purpose of the panic is to say, oh, this isn't good. There is a danger, and what do I need to do now? And I think that process itself can be really healthy for people to move them towards something better. It's complicated right now because of the medical system being, because of the COVID virus and all of that's going on with that, and in terms of where to reach out and what to do. But I think at least to begin to understand that as a part of the process of moving forward. And if you are in real danger, then do it sooner than later.
Yeah, it is interesting how these things amplify situations that are already ongoing, and a lot of times that can be the outcome that can be healthy is saying, oh, well, let me learn from this for next time, to be a little more prepared or to be in a little bit better situation. I think so often we just go into survivor mode that maybe we don't stop to think about, okay, this too will pass, and at that point I might find that there'll come something else down the road where I would like to be free.
Definitely. Right, because it's a balance between, you don't want to do something that's dangerous. You don't want to become erratic in your behavior and worsen anything, but you do want to take notice of what it is that's dangerous. And so it's complicated, I think, right now because of limited options in reaching out, at least for maybe the moment. But I think there still are options. If you're ready to do something and get into treatment and so forth, you can still reach out and contact people and set things up. And usually as soon as there's something set out and there's a way forward, people immediately begin to feel better anyways.
So really laying the groundwork. It's interesting as you say that. This is a good time, particularly for those that might actually be quarantined or not able to work or whatever, to start looking at how would I lay groundwork for that in the future when I'm able to access treatment. That's a good point. That's a good idea.
Exactly right. So let's say you're in a situation where whatever, if you're using opioids or in some way, and you realize it's, you've got to make a change, you can reach out and begin to create a dialogue, and you can certainly reach out to us, and we can create a dialogue and begin to put a process together, to move things in a different direction. So that's an idea. No one's exactly sure, or I'm not exactly sure, when that is, or I guess there's factors. Claire maybe could speak to this better. But, because of some of the limitations medically right now with hospitals.
Yeah. Again, Domus, again, we are still open. We are trying to keep, instead of 6 patients, that is a very small amount of people in a 6,000 square foot house. We are actually keeping 3 at the most to give patients that extra, space. Domus, we're very lucky because I had created an environment where privacy was, respected. So every room has their own veranda, and it's a private room. And because the house is 6,000 square feet, it allows patients to have enough space between them, and respecting, even more than 10 feet of distance. Dr. Lowenstein still can see them, obviously, through the internet. So there are things that we have been able to keep in order to help people. We're all going to have to do a lot of adapting in our lives from here on. I don't think for a long, long time we are going to be very relaxed, especially on human contact.
Someone actually said, "Boy, this is, I guess, as good a time as any for this to happen. The benefits we have now is we can still have some medical appointments, we can have some online services, we can still watch Disney Plus, so we have something to do even during that time." But looking at that redefinition of human contact, I think that's also something that's going to be in the longer term. That it'll be very interesting to see how that shapes not only the treatment and sobriety path that people are going on, but also to see how that changes the expression of dependence also, and that the way that that's going to affect that, of how that is going to play out. I'm not even sure if we know very much about what all that's going to be.
Obviously, other than life itself, that's going to be our biggest loss in this virus throughout humanity, is going to be the lack of human touch. It's going to be the ease of, hugging somebody, kissing somebody, holding somebody's hand. It's so incredibly important when we feel somebody's energy, when we are at need. So I think not just in the addiction world, but as families, as parents, as, siblings. My daughter said to me yesterday, when this is all over, I just want to hug you and I don't want to let go.
Yeah.
So I think that will be, because as much as we are going to do it, there's not going to be an ease about it. There is not going to be a total let go of your emotions. And that's what hugging somebody is all about, is, becoming vulnerable, allowing somebody to hold you for that second. And I think that ease is going to be gone for at least for a while.
I imagine, although I don't know what's exactly, hopefully there's going to be a vaccine or remedies or things that are going to make this, or maybe it'll go away. But I guess we'll be living with this to some degree for a while we have to take precautions because of how dangerous it is. But you're right. But we also have to sort of live and carry on and assess other needs as well. And I guess it's, ultimately these are personal decisions, but difficult ones. And, especially as time goes on, and this, as you're both pointing out, where, other needs become, have been put off for a long time, like the need for contact.
And do you think of the role that self-medication plays in some of the psychological loneliness and distance that already exists for many people for various reasons, mental health and just maybe upbringing and experience, and different reasons people feel disenfranchised anyway from that affection, than to say, well, that's amplified now by realistic concerns of exposure and whatever long-term cultural, things we have to recover from.
I hope to God that if there is any changes in the amount of resources to the people in this country, it will be directed to mental health. The lack of mental health, the lack of accessible and effective mental health is the cause for homelessness, addiction, so many issues that has plagued the world, but especially this country. So I think if something good can come out of this, it would be changing how mental health is accessible to the public. We need to do something about it, and we need to do something about it now, especially after leaving so many people with the levels of depression, anxiety that has been brought through this crisis.
It is interesting
It's
to me
time.
to see how people pull together. And you see a lot of cool things people are doing to try to reach out, and it leaves me feeling like I'm glad we can pull together as a people. But just imagine if we could pull together when we're not under threat of exposure to a pandemic, right? If we could just kind of keep that pulling together mentality together all the time, what kind of things we really could accomplish.
I agree with you 1,000%.
One of the opportunities that it does present that I think applies to the dependence and addiction problem, but also applies just to everyone, is that it's a good opportunity to look and say, now that we're more hyper aware of the loneliness and the isolation that people can feel, who in our own family, who in our own system, our friends, family, colleagues, even whatever, who is it that we're noticing or thinking about saying, boy, I should reach out to that person? Because it's harder. It'll be probably, in some ways we can avoid issues and avoid seeing each other, but it will probably be harder to hide struggles in a way as we're going through this kind of a thing, especially from those that are usually people we're intimate with. They'll be more likely to notice. And that is a good thing because maybe people can notice when there's a need.
I 100% agree. And I think recovery is also available in maybe a little different way than it was if you're willing to fight a better health. This is a great opportunity to start. How fast, how intense, obviously different, but it's a great time to start.
And that's a good thing to keep in mind. I know that in my office and other counselors that I know, and you've mentioned that for you guys as well, the phone lines are working to the extent that we can. And you had mentioned with Dr. Lowenstein still able to do medical evals to whatever extent he can to help people to figure out what the plan should be and what level of crisis they're at. So something that I think is a recurrent message in this podcast, don't go it alone. You don't have to. There are people who are there that are trained to help and people that do care if we just put ourselves out there to ask for help.
Absolutely. As human beings, we are all hopefully stepping up to the plate, offering whatever we have, even at our own limited abilities. We are sharing what we have.
Right. And this may be a time where our technology really can bridge a gap in a way that we haven't necessarily needed, especially in healthcare, where people who need attention and need advice can reach out and you can get it, kind of making the effort to figure that out. And it's usually not that difficult. If someone's in a place where they're concerned about something, reach out.
And if Skype drops your call, don't be afraid to call again. It's a metaphor. Our own recording today is a metaphor.
Right. Yeah.
Well, we're going to leave it there and put out a plea to you once again to whatever your needs are, reach out to those around you. Take a good hard look for those around you who can help. And also for those who might need your help. No matter how much you need, you have something to give. And whatever you have to give, make sure to look around to see who needs it. As Claire mentioned, the Waismann method is open for answering questions and helping people to start the process. There's some things we can do to maybe help out to set some of those plans. Look around for others in your area and community as well to be able to get some of that medical help. Don't let yourself just try to muscle through this period. Make sure you're taking care of yourself medically, emotionally, and psychologically. We're going to be with you through this crisis as well, which means we'll be back again with you soon, talking about questions and answers around opioid dependence and the related issues that you find there. So remember, until then, keep asking questions, because when you have questions, you have answers, and whenever you have answers, you do have hope. If you want to see more information about the Waismann method, go to www.opiates.com or follow us on Twitter @opiates. For Clare Waismann and David Livingston, I've been Dwight Hurst. We'll see you again soon. This podcast is produced by Popped Collar Productions, a company helping you reach your goals through podcasting applications. To learn more, visit poppedcollar.net.